Hello, I'm Dr. Mark Besancon with Hillcrest Animal Hospital, and this is your pet tip of the month. February is National Dental Month, and this is the month that veterinarians try to make pet owners aware of dental disease in their pets. Two big problems that go on in the mouth, gingivitis, which is just redness of the gums, followed by a more severe case of what's called periodontitis, where the actual structures of the teeth are involved and you may develop loose teeth. Typically 20 minutes after a pet has had his teeth cleaned, the proteins in the mouth will already start to form on the teeth, followed by 6 hours of colonization of bacteria, and then 12 to 24 hours of actual tartar formation and plaque formation. And then 3 to 5 days they will actually form calculus on the teeth. And so this develops pretty fast, and so definitely need to be aware of it and know what to look for. Things to look for: foul-smelling breath. That's typically the number one thing that most owners will notice. They may drool, your pet may drool, may not want to eat hard food, their mouth just hurts. Other things to look for in the mouth, which I'll show a model right now to show you what to look for. Red gums. If you see red gums, that's a good sign that we have some problems going on. A little bit of tartar formation on the teeth. It's shown by this tooth right here. Some crowded teeth as well, broken teeth. You may have loose teeth. Just several things to look for in the mouth that may be a problem. Some risk factors: little puppies and or small breed dogs that have crowded teeth. This allows for that bacteria to form in that mouth. Just gives more of an area for that stuff to form and causes problems in the mouth. Dogs or cats that groom themselves, that's a big risk factor, that the hair gets wrapped around those teeth and that bacteria likes to hang out in that hair and causes a lot of problems, can even cause little pockets up in those gums as well. Poor nutritional state of the pet, need to make sure that these guys are on a good food, make sure that they have good nutrition, and make sure that there's not any other problems going on with these guys. Other illnesses is another thing: diabetes, kidney problems, stuff like that. Definitely make sure that your pet's having annual exams with your veterinarian and make sure that other things aren't going on, as well as dental problems. Soft foods is another risk factor. Hard foods tend to break off some of that tartar and plaque. Soft foods tend to just work around the teeth, and so it can cause more of a problem in the mouth. How do we diagnose this? Typically it's diagnosed at home. A lot of pet owners will notice the foul-smelling breath, the drooling. Come in for an exam, annual exam, we'll notice loose teeth, red gums, bleeding gums, and so that's several things that you'll probably notice at home before even coming into the vet clinic. Probing, a lot of times we'll probe the pockets next to the teeth. The gums will develop pockets where bacteria like to go and form in there and start the process that I had described earlier. And so we can probe these pockets and see how deep they are and assess the severity of the disease. X-rays, radiographs are also used. That's another tool that's used to assess the bone structure of the mouth, of the jaw, of the teeth, make sure there aren't any abscesses in there that could be causing more of a problem, and then work with your veterinarian as far as how to treat these guys. Treatment, typically it depends on the severity of the disease. Work with your veterinarian to come up with a plan to treat your pet. Dental prophies are done, and this is where dogs and or cats are put under anesthesia and the teeth are scaled clean and then polished. Typically polished. They may be probed at that time as well, charted, and x-rays will typically be taken at that time to assess the severity. Teeth that need special attention can get that at that time, and or if they're loose or past the point of treating, they may be pulled at that time as well. Extractions are pretty common if the disease has gone on for a long time and have a lot of problems. Antibiotics, a lot of these guys are placed on antibiotics. The bacteria in the mouth can sure spread, and we sure want to make sure that that's under control as well. So that'll be a decision by your veterinarian as to how everything is treated depending on the severity. The big thing is treatment at home. How do we prevent this? Good home health care is good to prevent dental disease. Brushing of the teeth, there are several products out there. Toothpaste, I do not recommend using a human toothpaste. It will foam up too much. There are several products out there to brush the teeth on these guys. dental chews, dental bones, treats. There's a lot of those available. A lot of them have impregnated with some type of antiseptic in there to help clean the teeth, as well as the mechanical action of the chew to help with getting that off. A lot of gels, rinses are out there. Work with your veterinarian on what works best for you. There's some additives for water that help as well. Diets, there's a couple diets out there that help with tartar on the teeth. Like I said, just work with your local veterinarian to come up with a plan for an overall health care plan for your pet and dental plan. Thank you.